I'm going to be performing an abdominal assessment on my patient. I've already completed my national patient safety goals. The first thing I'm going to do is flatten my patient's bed. Next, I'm going to lift my patient's gown, so I'll make sure that I have permission to do that. So I'm going to maintain my patient's privacy while also exposing their abdomen. So the first thing I want to do is inspect my patient's skin. I'm looking for rashes, lesions. I'm looking at my patient's hair distribution, if they have hair on their abdomen. I'm looking for pulsations. I should not see any pulsations. I'm also looking at the contour of my patient's abdomen. So when I'm assessing for the contour, I want to make sure to do this from 2 angles. So right now I'm looking at my patient's abdomen from the side, and I'll also go to the foot of the bed and assess the contour. From here, I would document my patient's contour as flat, which is normal. Next, I am going to auscultate. I'm going to be using the diaphragm of my stethoscope to listen for bowel sounds, and the abdomen is cut into 4 quadrants. So I'll use the umbilicus as a landmark to identify my 4 quadrants. So there's going to be an imaginary line vertically down the umbilicus, and then there's also an imaginary line horizontally, and so that's where you get your 4 quadrants. So I'm going to start in the lower right quadrant and work my way clockwise. So lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. So I'm going to listen, and as soon as I hear bowel sounds, I can move my stethoscope. If I were listening in a quadrant and I did not hear any bowel sounds, I would need to listen for a full 5 minutes in order to document that the bowel sounds were absent. So that would be 5 minutes in each quadrant that I would need to listen if there were no bowel sounds in order to document absent bowel sounds. While I have my stethoscope on, I also want to listen for bruits in the abdominal aorta. So I'm going to change my stethoscope and turn it to the bell to listen for bruits. Bruits are turbulent sounds that are lower pitched sounds, which is why I want to use the bell of my stethoscope. And the place that I want to put my stethoscope is going to be about 1 inch above the umbilicus, which is where the abdominal aorta will be. And so I'm going to be listening for bruits here. You may hear bowel sounds still in this while your stethoscope is here, but once again, we're listening for bruits, which are turbulent blood flow sounds, and so we do not want to hear a bruit in the abdominal aorta. Okay. Next, I'm going to palpate the abdomen, and before I do that, I want to ask my patient if they're experiencing any tenderness. If they are experiencing tenderness, I would want to save that region for last. My patient does not have tenderness, so I'm going to start in the lower right quadrant. While I'm palpating, I am asking my patient if they have any tenderness while I palpate. I'm also feeling for any abnormal masses, and I'm also checking for hernias. So our patients can have umbilical hernias, they can also have inguinal hernias. Sometimes if hernias are large enough, you can see them upon inspection, but you'd also be able to feel them as well. The next thing I want to do after palpation is to percuss my patient's abdomen. So I'm going to be using my middle finger on my patient's abdomen, and then I'm going to be striking with my pointer finger. So I'm going to percuss each quadrant. Next, I'm going to lower my patient's gown and put their blanket back into a comfortable position. And the final part of the abdominal assessment is to check for costovertebral angle tenderness. So I have my lovely model, and the significance of the costovertebral angle is that is the area that overlies the kidneys, and so whenever we check for costovertebral angle tenderness, we are asking the patient if they're experiencing any pain when we strike their back. So the angle is their spine meets their ribs, and so that's where I'll strike. So if you have problems finding it, what you can do is ask your patient to take a deep breath so you can figure out where their ribs end. So I'm gonna strike about here. I'm gonna use my left hand to blunt the hit, or when I strike her back. So I'm gonna tell my patient, I'm going to strike your back. Let me know if you have any tenderness. Okay, and then I'm also gonna check the other side, because remember she has 2 kidneys and they're about here. All right, I'm gonna strike your back again. Let me know if this hurts. Okay, and it is a pretty firm strike. Like I said, this can be significant of inflammation of the kidneys, which could mean pyelonephritis, so that's why we check for costovertebral angle tenderness. So my patient does not have any tenderness while I strike their back, so that is a normal finding, and that completes our abdominal assessment.